Chapter 19, Implementation. Implementation constitutes the fourth step of the nursing process, with a care plan based on clear and relevant nursing diagnoses. A nurse initiates interventions that are designed to help the patient achieve the goals and expected outcomes needed to support or improve the patient's health status. A nursing intervention is any treatment based on clinical judgment and knowledge that a nurse performs to enhance patient outcomes. Ideally, nursing interventions are evidence, providing the most current and effective approaches for delivering patient-centered care. Direct care interventions are treatments performed through interactions with patients. Indirect care interventions are treatments performed away from a patient, but on behalf of the patient or group of patients. Documentation and interdisciplinary collaboration. Nurses must be able to manage conflict and effectively advocate for patients in challenging interdisciplinary relationships. Thus, it is important for implementation to be patient-centered. Consider these factors during the implementation process. 1. Who is the patient? 2. How do the patient's attitudes, values, and cultural background affect how you provide care? 3. What does an illness mean to a patient and his or her family? 4. Which clinical situation requires you to intervene? 5. How does a patient perceive the interventions that you will deliver? And 6. In what way do you best support or show caring as you intervene?
Case study. Miranda is a nursing student who is assigned to Mr. Bagley. Mr. Bagley is a 52-year-old Asian who was admitted to the medical surgical unit for management of tuberculosis. Mr. Bagley travels internationally because of his executive position with a global company, and most likely contracted tuberculosis during his travels. Mr. Bagley's current symptoms are shortness of breath, night sweats, muscle pain, fatigue, and a productive cough. Miranda reviews Mr. Bagley's plan of care to determine which interventions are to be implemented first. Throughout the lesson, we will give examples of implementing nursing care with respect to Mr. Bagley's case. Keep him in mind as we discuss the process. Standardized interventions most often set a level of clinical excellence for practice. Healthcare settings offer various ways for nurses to create and individualize patient care plans. It is critical for each patient to have his or her unique set of interventions. However, many healthcare systems have mechanisms for standardizing the more common types of interventions. American Nurses Association defines standards of professional nursing practice. The Quality and Safety Education for Nurses has defined skills competencies. These standards are authoritative statements of the duties that all registered nurses are expected to perform competently, regardless of role, patient population they serve, or specialty. The nurse healthcare provider-initiated standardized interventions are available in the form of clinical guidelines or protocols, pre-printed, known as standing orders, and nursing interventions classification interventions.
Evidence-based research provides the basis for sound clinical practice guidelines and associated recommendations that can improve quality of care. Clinical practice guidelines and protocols offer a systematically developed set of statements that helps nurses, physicians, and other healthcare providers make decisions about appropriate healthcare for specific clinical situations. These guidelines establish interventions for specific healthcare problems or conditions. The National Guidelines Clearinghouse, or NGC, is a public resource for evidence-based clinical practice guidelines. The NGC guidelines are linked to a particular term derived from the U.S. National Library of Medicine. Medical subject headings, a controlled vocabulary for disease condition, treatment intervention, and health services administration. Clinicians within a healthcare agency sometimes review the scientific literature and their own standard of practice to develop guidelines and protocols in an effort to improve the standard of care at their facility. Another valuable source for nursing practice guidelines is the University of Iowa Hartford Center, which has evidence-based practice, or EBP, guidelines for geriatric nursing. Advanced practice nurses who provide primary care for patients in a variety of settings frequently follow diagnostic and treatment protocols for their interventions. A standing order directs the conduct of patient care in a specific clinical setting. Licensed prescribing healthcare providers in charge of care at the time of implementation approve and sign standing orders. Standing orders give nurses legal protection to intervene appropriately in the best interests of patients with rapidly changing needs.
The NIC interventions offer a level of standardization to enhance communication of nursing care across settings and to compare outcomes. The NIC system has been incorporated into many healthcare information systems. By using NIC, you will learn the common interventions recommended for the various NANDA nursing diagnoses. The ANA standards are formally reviewed on a regular basis. The newest standards include competencies for establishing professional and caring relationships, using evidence-based interventions and technologies, providing ethical holistic care across the lifespan to diverse groups, and using community resources and systems. In addition, the standards emphasize implementing a timely plan following patient safety goals. The QSEN Institute has established standard competencies in knowledge, skills, and attitudes for the preparation of future nurses. The goal of QSEN is to prepare nurses so they can continuously improve the quality and safety of the healthcare systems within which they work. Clinical judgment includes making appropriate conclusions about interventions to address a patient's response to health conditions or a life process. Clinical judgment requires the nurse to use, or modify, standard approaches, and sometimes to improvise new ones. You learn how to implement nursing care by applying appropriate knowledge, experience, attitudes, and standards of care. Interdisciplinary relationships, particularly those between nurses and healthcare providers, contribute to nursing judgments in the degree to which you pursue understanding a patient's problem and intervene effectively. Critical thinking allows you to consider the complexity of interventions, changing priorities, alternative approaches, and the amount of time available to act. As you implement interventions, use critical thinking to confirm whether the interventions are correct and still appropriate. Even though you have planned a set of interventions for a patient, you have to exercise critical judgment and decision-making while delivering each intervention. Make it a point to always think before you act. You are responsible for having the necessary knowledge and clinical competency to perform interventions for your patients safely and effectively. Please review Box 19-3, Evidence-Based Practice, Interdisciplinary Practices, as a supplement to this PowerPoint. Shown as Figure 19-1, Critical Thinking, and the Process of Implementing Care. The critical thinking model provides a framework for how to make decisions when implementing nursing care. You learn how to implement nursing care by applying appropriate knowledge, experience, attitudes, and standards of care. Tips for making decisions during implementation. 1. Review the set of all possible nursing interventions for a patient's problem. 2. Review all possible consequences associated with each possible nursing action. 3. Determine the probability of all possible consequences. And 4. Judge the value of the consequence to the patient. The performance of nursing interventions for a patient is part of clinical decision-making. It is important to know the purpose of an intervention, the steps in performing the intervention correctly, the current medical condition of the patient, and his or her expected response. As you gain clinical experience, you are able to consider patterns of responses from similar patients, and the interventions that did or did not work previously and why. As you perform a nursing intervention, apply intellectual standards, which are the guidelines for rational thought and responsible action. A critical thinker applies critical thinking attitudes when intervening. When you are unsure of how to perform a procedure, be responsible. Seek assistance from others. Confidence in performing interventions builds trust with patients. Creativity and self-discipline are attitudes that guide you in reviewing, modifying, and implementing interventions. As a beginning nursing student, seek out supervision from instructors, or experienced nurses, or review agency policy and procedures, to guide you in the decision-making process for implementation. Implementation process. 5 preparatory activities are reassessing the patient, reviewing and revising the existing nursing care plan, organizing resources and care delivery, anticipating and preventing complications, and implementing nursing interventions. During the initial phase of implementation, reassess the patient to be sure that you have selected appropriate interventions. The reassessment helps you decide if the proposed nursing actions are still appropriate for the patient's level of wellness. Reassessment is not the evaluation of care or determination of a patient's response to an intervention, but it is the gathering of additional information to ensure that the plan of care is still appropriate. If a patient's status has changed, and the nursing diagnosis and related nursing interventions are no longer appropriate, modify the nursing care plan. Modification of an existing written care plan includes 4 steps. 1. Revise data in the assessment column to reflect the patient's current status. Date any new data to inform other members of the healthcare team of the time that the change occurred. 2. Revise the nursing diagnosis. Delete nursing diagnoses that are no longer relevant, and date any new diagnosis. Revise related factors and the patient's goals, outcomes, and priorities. Date any revisions. 3. Revise specific interventions that correspond to the new nursing diagnosis and goals. Be sure that revisions reflect the patient's present status. And 4. Choose the method of evaluation for determining whether you achieved patient outcomes. Please review Figure 19-2. Concept map for Mr. Lawson. Implementation. As a supplement to this PowerPoint.
Preparing for implementation means ensuring that a patient is physically and psychologically ready for any interventions or procedures. Nurses must assume dual roles, that of a patient care provider and an organizational employee. Time devoted to nursing care has 3 components. 1. Physical, which is the physical amount of time consumed in the completion of nursing activities. 2. Psychological is what nursing care patients experience, and how they experience it. And 3. Sociological, which is the sequential ordering of events within the daily routines of a practice setting. Delayed and hurried responses convey disinterest, whereas timely interaction conveys care and concern. Apply time management principles. Before performing an intervention, decide which supplies you need and determine their availability. The nurse's role in a team nursing model differs from that in a primary nursing model. As a nurse, you are responsible for deciding whether to perform an intervention. Delegate it to an unlicensed member of the nursing team, or have an RN colleague assist you, you have a legal duty to follow delegation guidelines, and only delegate interventions within the delegate's training and ability, according to the State Nurse Practice Act. Patient care staff work together as patients' needs demand it. A patient's care environment needs to be safe and conducive to implementing therapies. Patient safety is your first concern. Arrange environment to prevent injury. Make surroundings compatible with care. For example, maintain patient privacy. Ask visitors to leave if necessary. Reduce distractions when teaching. And ensure adequate lighting. Make sure that your patients are physically and psychologically comfortable. Offer comfort measures before initiating interventions to help patients participate more fully. Awareness of a patient's psychosocial needs helps you create a favorable emotional climate. Do not rush your care. Other strategies include planning sufficient time, or multiple opportunities, for a patient to work through and ventilate feelings and anxieties. Adequate preparation allows a patient to obtain maximal benefit from each intervention.
The 4 steps shown on the slide help you anticipate and prevent complications. Expert nurses learn to anticipate breakdown and deterioration of patients even before confirming diagnostic signs develop. Your knowledge of pathophysiology and experience with previous patients help identify the risk of complications that can occur. A thorough assessment reveals the level of a patient's current risk. Some nursing procedures pose risks. Be aware of potential complications and take precautions. Certain patient care situations require you to obtain assistance by seeking additional personnel, knowledge, and/or nursing skills. Before beginning care, review the plan to determine the need for assistance and the type required. When you are asked to administer a new medication, operate a new piece of equipment, or administer a procedure with which you are unfamiliar, follow these steps. 1. Seek the information you need to be informed about a procedure. 2. Collect all equipment needed for the procedure. And 3. Have another nurse who has completed the procedure correctly and safely provide assistance and guidance.
Implementation skills. The nurse is responsible for knowing when one type of implementation skill is preferred over another and for having the necessary knowledge and skill to perform each. Cognitive skills include the critical thinking and decision-making skills described earlier. Always use good judgment and sound clinical decision-making when performing any intervention. Grasp each clinical situation at hand. Interpret the information you observe, and anticipate a patient's response so you individualize patient care appropriately. Interpersonal communication is essential for effective nursing action. Develop a trusting relationship, express a level of caring, and communicate clearly with patients and their families. Good interpersonal communication keeps patients informed and engaged in decision-making, provides individualized instruction, and supports patients who have challenging emotional needs. Psychomotor skills require the integration of cognitive and motor activities. With time and practice, you learn to perform skills correctly, smoothly, and confidently. This is critical in establishing patient trust. You are responsible for acquiring necessary psychomotor skills through your experience in the nursing laboratory, the use of interactive instructional technology, or actual hands-on care of patients.
Time for a quick quiz. Nurse-initiated interventions are A. Determined by State Nurse Practice Acts. B. Supervised by the entire healthcare team. C. Made in concert with the plan of care initiated by the physician. D. developed after interventions for the recent medical diagnosis are evaluated. The answer is A. Individual Nurse Practice Acts determine nurse-initiated interventions. Direct care versus indirect care. Direct care treatments are performed through interactions with patients, whereas indirect care treatments are performed away from the patient, but on behalf of the patient or group of patients. Nurses provide a wide variety of direct care measures. All direct care measures require competent and therefore safe practice. Show a caring approach each time you provide direct care. Nurses spend much time in indirect care and unit management activities as well. Communication of information about patients such during a change of shift report or consultation is critical. This ensures that direct care activities are planned, coordinated, and performed with the proper resources. Case study. Miranda searches the hospital's database for additional information on tuberculosis. True or false? A clinical practice guideline is a collection of institutional policies that assist nurses, physicians, and other healthcare providers in making decisions about appropriate healthcare for specific clinical situations, such as the management of tuberculosis.
The answer is false. A clinical practice guideline, or protocol, is a systematically developed set of statements that assist nurses, physicians, and other healthcare providers in making decisions about appropriate healthcare for specific clinical situations. Direct care. A patient's need for assistance with activities of daily living, or ADLs, is temporary, permanent, or rehabilitative. When a patient is experiencing fatigue, a limitation in mobility, confusion, and/or pain, assistance with ADLs is likely. Assistance with ADLs ranges from partial assistance to complete care. Always respect a patient's wishes. Allow a patient to participate to the level that he or she is able, involving patients in planning the timing and types of interventions, boosts their self-esteem and willingness to become more independent. Nurses within home care and community health settings frequently help patients adapt ways to perform instrumental ADLs. Occupational therapists are specially trained to adapt approaches for patients to use when performing instrumental ADLs. It is important to anticipate how patients' illnesses will affect their ability to perform instrumental ADLs. Being aware of this allows for the nurse to make the appropriate referral so the patient has the resources they need at home. All physical care techniques require you to protect yourself and patients from injury. Use safe patient handling techniques. Use proper infection control practices. Stay organized, and follow applicable practice guidelines. To carry out a procedure, you need to be knowledgeable about the procedure itself, the standard frequency, the associated risks, and the necessary assessments before and after performing the skill. Always remain thoughtful of a patient's condition and how the patient has responded to the procedure in the past. Before performing a new procedure, assess the situation and your personal competencies to determine if you need assistance, new knowledge, or new skills. Performing any procedure correctly requires critical thinking and thoughtful decision-making. A life-saving measure is a physical care technique that you use when a patient's physiological or psychological state is threatened. Such measures include administering emergency medications, instituting cardiopulmonary resuscitation, intervening to protect a confused or violent patient, and obtaining immediate counseling from a crisis center for a severely anxious patient. Counseling is a direct care method that helps patients use problem-solving processes to recognize and manage stress and facilitate interpersonal relationships. Many counseling techniques foster cognitive, behavioral, developmental, experiential, and emotional growth in patients. Patient education is key to patient-centered care. Teaching focuses on intellectual growth, or the acquisition of psychomotor skills. When you educate patients, respect their expertise with their own health and symptoms, their daily routines, the diversity of their human experiences, their values and preferences as to how they learn, and the importance of shared decision-making. Know your patient. Also, know your patient's literacy level. An adverse reaction is a harmful or unintended effect of a medication, diagnostic test, or therapeutic intervention. Before performing any skill or task, you need to know the possible adverse effects or reactions that can occur. Primary prevention aimed at health promotion includes health education programs, immunizations, and physical and nutritional fitness activities. Secondary prevention focuses on people who are experiencing health problems or illnesses and who are at risk for developing complications or worsening conditions. It includes screening techniques and treating early stages of disease. And tertiary prevention involves minimizing the effects of long-term illness or disability, including rehabilitation measures.
Case study continued. Mr. Bagley's plan of care calls for oxygen therapy to improve his respiratory status. Question: a pre-printed document that contains orders for the conduct of routine therapies, such as oxygen therapy, is referred to as what? The answer is a standing order. A standing order is a pre-printed document that contains orders for the conduct of routine therapies, monitoring guidelines, and/or diagnostic procedures for specific patients with identified clinical problems. Time for a quick quiz. You are writing a care plan for a newly admitted patient. Which one of these outcome statements is written correctly? A. The patient will eat 80% of all meals. B. The nursing assistant will set the patient up for a bath every day. C. The patient will have improved airway clearance by June 5th. Or D. The patient will identify the need to increase dietary intake of fiber by June 5th. The answer is D. The patient will identify the need to increase dietary intake of fiber by June 5th. Outcome statement should have measurable and realistic goals. In this case, the goal is both measurable and realistic.
Indirect care measures are nursing actions that manage the patient care environment, and interdisciplinary collaborative actions that support the effectiveness of direct care interventions. Indirect care measures are actions that support the effectiveness of direct care interventions. Many of these measures may be managerial. Communication of information about patients is critical, ensuring that direct care activities are planned, coordinated, and performed with the proper resources. Any intervention that you provide for a patient is communicated in an electronic, written, or oral format. Communication is imperative to ensure that direct care activities are planned, coordinated, and performed with the proper resources. Many healthcare agencies use interdisciplinary care plans. Most important, all interventions must be documented correctly, and in the proper time sequence. Miscommunication is often the root cause for most reported adverse, or sentinel events that occur in healthcare organizations. Staff in many institutions develop interdisciplinary care plans, which are plans that represent the contributions of all disciplines caring for a patient. Always be clear, concise, and to the point when you communicate nursing interventions. Oftentimes, nurses who develop the patient's plan of care do not deliver the care. Some activities are performed by other members of the healthcare team. Here are 3 approaches for delegation based on the way RN and nursing assistive personnel or NAP assignments are made. 1. The unit-based scenario in which the NAP serves the unit. The NAP works off a task list usually found in the job description and has minimal direction from our interaction with RNs. Limited one-to-one delegation occurs. Lack of communication can cause conflicts too. Pairing is where one RN works with a licensed practical nurse, or LPN, and/or NAP for a shift. The RN, LPN and/or NAP are not intentionally scheduled to work the same shift each day. For any given shift they work together, or are paired, and care for the same group of patients. Delegation usually increases with pairing. 3. Partnering involves one RN and one LPN and/or NAP who are consistently scheduled to work together. The partners commit to healthy interpersonal relationships, trust in one another, and advance each other's knowledge. It is recognized that the RN has the authority to make the delegation decisions. Please review Box 19 examples of indirect care activities, as a supplement to this PowerPoint.
Case study continued. Mr. Bagley is placed on isolation precautions. Isolation precaution, as a treatment intervention, is an example of which type of care? A. Direct. B. Indirect. C. Prevention. Or D. Safety. The answer is B. Indirect care interventions are treatments performed away from the patient, but on behalf of the patient, or group of patients. Implementing isolation precautions is an example of providing indirect care by managing the patient's environment. Achieving patient goals. It is important to apply principles of care coordination, such as good time management, organizational skills, and appropriate use of resources, to ensure that you deliver interventions effectively and meet desired outcomes. Another way to achieve patient goals is to help patients adhere to their treatment plan. Patient adherence means that patients and families invest time in carrying out required treatments. Adequate and timely discharge planning and education of the patient and family are the first steps in promoting a smooth transition from one healthcare setting to another, or to the home. Effective discharge planning and education involve individualizing your care, and taking into consideration the various factors that influence a patient's health beliefs. When delivering care, it will be necessary for you to incorporate your patient's health beliefs, culture, lifestyle patterns, and patterns of wellness.